Hey guys, Dr. Steve with Gem Physio here. Just had a really interesting case that I wanted to record. It's a great case study, and hopefully if you guys will listen to it, you'll be able to help people with similar symptoms in the future. So I had a patient with groin pain on the left side, and his diagnosis was sports hernia, but they did ultrasound on him and there was no confirmed sports hernia. But this is the diagnosis they gave him to explain his symptoms. So I asked him what happened. He said he didn't really know. So I said, okay, well, I tell you what, maybe it's a sports hernia, maybe it is a pubic symphysis dysfunction, maybe it is an abdominal strain, or maybe it is your thoracolumbar junction is not happy and the nerves that feed into kind of your upper groin are irritated. So I did a hip screen, like moved his hips around. Moving his hips around did bring on some symptoms, but I suspected it was because we were just moving the hips, moving the stomach, moving the pelvis, moving the back, but the hip screen didn't precisely reproduce his symptoms. So then we moved on to pubic symphysis palpation. So I just had the patient take his own hands and palpate the front of his pubic symphysis. I asked him to put pressure. I said, does it feel painful or tender to you on either side? And he said, I'm not sure. And I said, I want you to push hard and tell me if the right side feels the same as the left side. The left side is the affected side. So he's pushing on the left side and he's like, no, it's definitely more tender on the left side. And he's like, and I said, does it reproduce your pain when you push on the left side? And he said, yeah, actually it does. And I said, okay. I said, you know what? You've got skin, ligament, bone. So I said, your pubic symphysis ligament on the left side is tender, and I think that you have a pubic symphysis dysfunction. So I said, you know, the way to get this would be like a very quick extreme stretch. He's a rock climber, so maybe he had a quick extreme stretch where the adductors pulled and brought the pubic symphysis out of alignment. That's one possibility. Another possibility, much more common mechanism of injury, is if you're walking and you are not paying attention and you step off a curb onto like a straight knee and a flat foot, and it just jolts your pelvis. You can get an upslip, you can get a pubic symphysis dysfunction. So he said, you know what, now that you mention it, I think that might have been what happened. I might have like stepped off a curb and like jolted my pelvis. I said, okay, you know, it's possible. We don't know, but it's possible. It certainly would be one way to get this. And so we went ahead and went right into the pubic shotgun. He's laying on his back, his knees are bent, I'm having him push maximally into my hands. And when I feel like his force is at its maximum, then I give a quick thrust into abduction. So using the adductor muscles, which pull on the pubic symphysis right, and we engage the adductor muscles and do a quick distraction to try to separate pubic symphysis. If we can do that, then when it springs back, right, it's going to spring back ideally in better alignment. That's usually what happens. It works really well. So we did that, and then I had him palpate pubic symphysis. The pain was about 50% better. Felt a lot less pain and tenderness there. We followed that up with, I wanted to clear his hips, so I manipulated each hip, and I wanted to clear his thoracic spine. And so I went up to like the T9 through L1 area, which can feed that area, T9 through L1. And we just manipulated thoracolumbar junction, got a lot of cavitations, so we cleared that out as well. Followed that up with some adductor isometrics, like 10 times 10 seconds, as hard as you can. And then followed that up with a frog stretch, so a super deep adductor stretch, kind of in a weight-bearing position. You're on your hands and knees are super apart, you're rocking back and forth slowly, feeling the stretch throughout. And really that was it. So at the end of the session, he said, man, I don't know if it's just like my mind playing tricks on me, but it's like, it feels a lot better. And I said, I expect it to. Let's see what happens. I said, I want you to work on your frog stretch, and I want you to work on adductor isometrics, pushing as hard as you can, trying to distract that pubic symphysis and help it to line up better. So he's going to work on those, and I'm going to see him in a couple of days time, and yeah, maybe we'll give an update. But I fully expect him to be 100% better in 2 to 3 sessions. Should be a simple fix. So yeah, super interesting. One note that I would say is, usually with pubic symphysis dysfunction, you would have adductor spasm, kind of groin pain, adductor spasm. He didn't really have any adductor spasm. However, when we did turn on his adductors, that also reproduced his pain. And that's because it's pulling on the pubic symphysis, which is in dysfunction. So he had tenderness at the pubic symphysis, and he had pain reproduction with pubic symphysis palpation on the left, and pain reproduction with adductor isometrics. And those were all greatly reduced after we manipulated pubic symphysis. So yeah, but yeah, normally there'd be adductor spasm. He did not have that. Normally you would see this kind of injury in like pregnant women, skiers, ice skaters, people who are taking like heavy impact through the legs, like maybe triple jump, long jump is possible. So anyways, super interesting. Hopefully if you guys ever have someone with pain in this part of the world, you will have them palpate pubic symphysis, and you can palpate over their fingers and just see if there's anything going on there. If there is, you can pubic shotgun it and then go from there. So yeah, thanks for tuning in, guys. Dr. Ford at Gem Physio, out.